Hi there, and welcome to Canceling COVID. I'm Tanya Rivens. We are your reliable resource when it comes to talking about COVID. It's not a stranger to any of us, and the impacts to our families, our finances, and our daily way of life is surreal. Right now, North Carolina reports 150 additional COVID 19 deaths and more than 5,000 new cases. And although an improvement, the numbers are still high and the vaccine rollout is still slow, especially in the Black community. Listen to this, more than two-thirds of the people vaccinated by Mecklenburg County Public Health are white. You heard me correctly, folks. And I want to go ahead and just jump in with this conversation. We know that everyone's practicing the physical distancing and wearing their mask and washing their hands. And now we have the vaccine. So bringing in our very first guest who has worked so diligently and so hard at addressing this is Dr. Reynard Washington, Deputy Health Director at Mecklenburg County Health Department. And Dr. Washington, if you need to go ahead and take your jacket off, that's fine. And look, we just put this together as we go along. I get it. I just realized I'm reading from the wrong script. So,
No, it's okay. Thanks for having me.
absolutely. So, good afternoon to you. And I'm not sure if you were able to hear how we started in. We're jumping in and addressing some of the concerns. You're the Deputy Health Director at Mecklenburg County Health, and you guys have been doing a great job. I salute you. It's not an easy job. There's so much that you've had to address. But let's talk about what comes to mind when you see the numbers breaking down where the vaccinations, when you break them down by race in Mecklenburg County. What are the thoughts that you have right off the gate?
Yeah, so I think there are a number of factors that are related to what you've seen. We always know in communities of color, access specifically to medical care has always been a challenge. There is a number of factors that drive that. Certainly, having access in our community is an ongoing challenge, but also there's a hesitancy, and I think you've seen probably some of the national data on sort of reported vaccine hesitancy among communities of color, where folks are scared, and so we have to do to make sure that folks understand that the vaccine is safe, that it's effective, and make sure people are willing to take it. I think the second I'll say is, we're vaccinating individuals in group one and group two. Group one is healthcare workers, which in fact people of color are underrepresented in many of the specialties in healthcare, frontline healthcare workers. And so we knew going into this, as we started with healthcare workers, that we'd start sort of, I guess, with some inequity or disparity and by race because of that. Now that we've moved to older adults, we are certainly working our as hard as we can to make sure, because we have appointment systems and we have phones and online ways to get appointments, that folks who don't have computers, who don't have smartphones, we have to make sure that we have access points for those individuals to be able to get the vaccine as well. And so folks who don't have access to those things, those tools, we got to make sure we have ways that they can get access quickly as well.
So, Dr. Washington, what are you doing to address that? Because legitimately, and even for seniors, last week we had some elders on, and they were even challenged to try to operate the computer, the technology. And that's not to take away from them because I have challenges myself. And so I'm saying, how is that being addressed?
Yeah, so we have a whole community engagement arm of our vaccine response. That the first one of the most important things we have to do is make sure people trust and that make people understand and have all the information about the vaccine that's accurate and is and at their fingertips, and that's most important. So there's a lot of buzz around the risk of the vaccine and the safety of it and how it was rushed and all those kinds of things. So we are working our community partners to make sure that they have accurate information at their fingertips that they can share with their constituents. So that's the pastors, that's community leaders, that's folks in fraternities and sororities, whoever has an audience. Like we want to make sure we're getting in touch with those individuals. Secondly, we're making sure that that the vaccine appointments are accessible to everyone. So we have really increased our capacity on the hotline. So we have individuals there to answer the call that can help you make an appointment online over the telephone, so you don't have to do that. For folks who don't speak English, we have translation services as well. And thirdly, most importantly, we're taking the vaccine into the community. So when folks cannot make it to our clinics, and we know everyone can't come to Bojangles, and so we are hosting community clinics in neighborhoods and communities and senior high rises. We're partnering with the Housing Authority, and we've now been to, I believe, 6 of their senior apartments to make sure that those residents in those facilities that are eligible get the vaccine. Just this morning, I was at a senior living facility off of Beatties Ford Road, working with the residents there again to make sure that those individuals don't have to go through all those loops and hoops. They don't have to worry about medical transportation if they're in wheelchairs, because we're taking the vaccine directly to them. And we're
And that's
doing more of that.
so, Dr. Washington, you've answered a lot because I wanted to talk about the numbers and how to improve them, and you've already laid that out. I was going to say if someone's looking to blame us, any individual or department for our numbers being so low, I'm not so sure if there's anyone that you can blame besides the system just trying to improve on what it's done in the past.
Yeah, and the reality of it is this vaccine rollout has happened really quickly. So we are working. There's a lot of uncertainty. It changes every day. We are the vaccine supplies I've explained before on the show. The federal government purchased it. They send it to the states, and then the states have to redistribute it to us. And so we don't know what vaccine we're going to get every week. And so we are currently the states made some adjustments so that we can better plan and know how much we're going to get. And the states also created an allocation. So they're basically taking some of the vaccine off the top to say, here, this vaccine we're giving you extra to make sure you can get into the community and give it to the folks who may not be able to access it otherwise. And so we are working hard to make sure that we do as much of that and looking for community partners to work with us. So churches, other organizations that are interested in co-hosting events, we're looking for those folks as well.
Dr. Raynard Washington, Deputy Health Director at Mecklenburg County Health Department, our public health system. And again, hats off to you and Director Gibby Harris for all the work that you're doing. I wanted to kind of shift and talk about the next phase, frontline workers and teachers and moving to that level. If you would maybe venture to say possibly March or April, or no
I
idea.
think so. So we are hopeful. We're really, really hopeful that the vaccine supply starts to pick up. We're also hopeful that another vaccine will come online pretty soon. There is obviously, I think you probably saw the news yesterday around the Johnson & Johnson vaccine applying for emergency use authorization. So we're really hopeful. The federal government has purchased more vaccine. And so I think with all those things happening, we're hopeful that we'll get through groups 1 and 2, or at least be able to get through a large enough proportion of those groups that we can move into group 3 within the next several weeks. So we're really anticipating that we'll get there as quickly as we can. Again, our biggest limitation right now is the supply of vaccine. So having enough vaccine to give to everyone. So we're working to make sure we get there quickly, and then we're working to make sure that the folks who need it the most in those groups get it, and also making sure there's equity in those groups. The group 3 is a much larger group. So when you think about our frontline essential workers, it's the teachers, it's the law enforcement officers, it's the grocery store workers, it's the pharmacy techs. It's a lot of folks in that group. It's a pretty big group.
And
Uh,
a lot of people are encouraged to hear that. One of the questions I was going to lead to was moving the teachers up as far as vaccinations. But clearly, you're in support of that. There's been a lot of controversy because some of the research is saying teachers didn't have to be vaccinated for the schools to be safe. And most people have said, it's a full approach. Practicing all of the tools that you have in your toolbox. But if you expect that we're going to move, and I didn't mean to say toolbox, but toolbox,
yeah,
the fact that we're expecting it by March, a few weeks, and school teachers will be included in that pool that you're going to reach out to law enforcement and essential frontline workers, then that's certainly encouraging. For people that are still concerned, or one of the things I skipped over for a moment, Dr. Washington, we usually have a question of the day. So for those who are watching, what should take priority in the next federal COVID spending bill? Because we know that one has just gotten approval, and I know a lot of people look for the $1,400 stimulus payment that they'll be receiving. But the question really is, what is the top priority? Because again, it's going to take a whole lot. So the priority for the federal COVID relief bill is the question of the day. Now, Dr. Washington, for you all, funding for all of these things that are getting thrown at you, how are you able to address this? Because clearly, when it comes to the budget, you're way out of whack with everything that's been happening.
Yeah, we're way over budget to say the very least. But we are working and we are anticipating. I will certainly say for the federal sort of relief bill, I know people on the ground, our families in our communities are struggling. These are tough economic times for a lot of families. So I think any help to families is certainly a priority. My own selfish interest in terms of the relief is certainly additional support for the health departments, for local governments, for state governments who are on the boots on the ground doing this work every day. We have, if you've been to the Bojangles Coliseum, you can see the number of staff it takes to make these operations run. As well as we still have to do our regular work. Our STD clinic is still operating, and so we're definitely tight on resources around here. And so certainly any support for local and state governments. But I think the top priority has to be helping out our families. Families are struggling; these are tough times, and so certainly anything that provide a relief to folks is really critical.
Dr. Raynard Washington, we're always so appreciative when you join us. I do want to add, however, we've had some complaints that we've seen online, and we know anything that you roll out is not going to be perfect. You've already mentioned, how expeditiously it had to happen. So, it's been really a whole new, just throw out the rule book as far as trying to get everything together. But some people have complained that they've had their appointments canceled when they've scheduled them to go and be vaccinated, and that when they've gotten to the sites, there's been some challenges that is. Do you guys anticipate, or have you heard any of these complaints, or working these quirks out so that you maybe can increase the volume that you're putting out weekly?
Yeah, so we are so restricted by just the number of doses that we receive from the state. We have virtually no control except for the lobbying that we do to say we need more, we need more, we need more. And certainly the health department has not canceled appointments. The only instance is if a person signs up for an appointment and they're not yet eligible. We'll just say you can't have this appointment because there's somebody who's 70 that needs it and you're only 64 and a half.
Right.
So certainly those some circumstances, and we know people are really just trying to do the right thing, get the vaccine, and we're excited about the excitement for it. But folks got to they got to wait their turn, and so that's certainly a challenge. We are working to make sure that the process is as smooth as possible for folks when they come to the clinics as well. We know every operation has its limits, right? So there's always a challenge. So we appreciate constructive feedback and are doing everything we can to be as responsive and as quickly as possible.
And Dr. Washington, I might add, we took my mom, and we had no problems. And there was no point. We were even told when we scheduled that they don't turn anyone away.
Yep.
And they were very, I mean, just so considerate and gracious. She's 84 and a half, soon to be 85. And, thank God for her every day. And she's one of the ones that we decided, we need to go ahead and have her vaccinated. And I would say, for those that have had the challenges, at least try, give a call back, because I haven't heard, or I didn't experience that at all. And I know every once in a while something may fall through the cracks. So again, Dr. Raynard Washington, he's a Deputy Health Director, Mecklenburg County Health Department. The number you can see on the screen, 980-314-9400. As we wrap things up, is there anything else that you would like to share as we move on to our next guest?
Yeah, no, I guess I'll just continue to encourage our community to stay strong and to rely on each other and as best possible. These are tough, but we need everyone to continue to stay home as much as possible, to keep their distance, to only go out for essential things, and to remember to wear your mask when you're out and around others, and don't have any gatherings. And the most important thing I'll say is it's Super Bowl
I
weekend.
was getting ready to say
Don't
that.
gather. Please do not gather. We really, I'm smiling but I'm serious as a heart attack. Like we don't need folks to gather. We are just coming. Our numbers are going in the right direction from the gatherings over the holidays, and we really need folks to to stay home with their family.
Yeah, and I was going to, before I let you off the hook, I was going to say we got the Super Bowl this weekend. People are just tired of staying home, and so here we go again. Hopefully, we won't experience the big gatherings, and then we'll have another bump in the other direction. And so,
Yeah,
hats off, guys. We're headed in a positive direction finally. So,
finally.
yeah, it's so good to talk to you, Dr.
Thanks,
Watt.
Tanya. I appreciate it.
Oh, I appreciate you too. Take care. Have an awesome day. The Mecklenburg County Health Department working real hard for us guys in the community, and nothing is going to go completely smoothly. We have to know that. And North Carolina could actually soon get billions to reopen schools, to distribute the vaccines, and help families struggling that is to pay rent. It just hits us at all sides. What can we say? Governor Cooper still needs to sign off on a massive coronavirus relief bill. State lawmakers have unanimously passed it on yesterday. That brings us to our question of the day again. What should be prioritized in the next federal spending relief bill? 54% in a new national poll say stimulus checks will, you know, stimulus, more money. We've got to also start looking at infrastructure that is, and focusing on some of these things that will help us to get back into the workplace. So the question of the day, chime in for those of you that have hopped on. I'd love to hear what should take priority in a federal COVID relief bill. Now, there's a group of people we don't hear enough about, and they are COVID-19 survivors. And I respect all that have gone through this. So many of them are still dealing with physical, emotional, and financial issues months after they've recovered. My next guest is Joe Lowry, and he had COVID in July. He was having a few problems hopping on. Looks like we're not able to get him on, but he had COVID in July, and months later still has major side effects. And I had a conversation with him, and he really is somebody who never really been in the forefront, who's never taken the role of leadership when it comes to addressing something along these lines. And I regret that we're not able to get him on because he really wanted to share his story. He said, Tanya, we've got to get the word out. People don't want to talk about it. I really want to talk about it and share my story. So we may have to reschedule him. I'm getting a note again from my producer, No Joe, and that's unfortunate. Again, when it comes to technology, everybody's not able to hop on and maneuver it. Not saying that was the case. Sometimes it's just internet issues. You see, I deal with it here. So I'm not trying to take away from anyone. I'm just here trying to help. And I regret that we weren't able to get him on. We probably should have reached out to him a little bit earlier than the normal hop on time. But we do have new help for seniors that are struggling to make vaccination appointments. The North Carolina Baptist Aging Ministry, they want to help to make it easier to sign up. And that number, the hotline, it's for anyone 65 and up through that. They'll help you go through the process. It's 877-506 2222 is my guess. We're missing one number there. So 877-506-2222 should be the number again for anyone age 65 and up, the North Carolina Baptist Aging Ministry. Also, our question of the day: what should be prioritized in a federal spending bill for COVID relief? I see more hopping on. Kevin Graham, if you could answer that question. I see the G Man. We'd love to hear your thoughts on that. And Miss Dept McKinney, she says, love what you're doing. I love that you hopped on and appreciate what you're doing as well. Let me know your thoughts. What should take priority in a federal COVID relief bill? And as we're looking at that, some other news that has come out that's quite encouraging is this Sunday, Coolwood Middle School, they are hosting an event in partnership with Apex Leadership County or Company of the Carolinas. So that's Apex Leadership Company of the Carolinas. They're hosting an event on Sunday, and you're invited to come out. They are offering testing. DJ Bless will be there. They're serving food, giving out essential items, and lots of information. And it's Super Bowl Sunday, so the event is from 2:30 until 5 p.m. So kind of spread the word, share with information, because if you recall, we had Dr. Black on Wednesday, and one of the issues is our people, our community, we're not getting tested. And she shared that by the time we get tested is when the symptoms show up. Then it's a little too late. Not sure what happened to my screen there, but we're back. If you could spread the word. And I was talking to someone yesterday, and they were like, well, you know what? I thought you only had to get tested if you had symptoms. So there's so much misinformation out there. That's why we're trying to provide education and get you the information that you need. So encourage everyone to get tested. There's free testing happening all over the city, all over the state. And there's one I just mentioned on Sunday at Coolwood Middle School, 2:30. Your opportunity to go out and get tested again. Kind of going against what everyone or some people have understood. You only get tested when you have the symptoms. They want everyone tested. So take your whole family and head out and get tested. Some other great news is Walgreens is going to be offering vaccines in about 330 stores. That's coming down the pike real soon. Novant Health is planning on opening a Walgreens health clinic. So everyone's coming together, and that's great to see. I see Anna Louise Pryor Gates has hopped on. Good afternoon. Perhaps you would like to chime in on the question of the day. What should, in your mind, take priority in a federal COVID relief bill? 54% said they need more money. But what about getting back to the workplace, getting back to a safe workplace, getting our kids back into school safely? And we know that's going to take funds, it's going to cost, but certainly we want to get them there. As we continue, we're having some problems again. We had a COVID survivor. We can always reschedule to get him on. And I'd love to get him on and share his experience because he's kind of become an ambassador to share the word with a lot of individuals that don't realize that there are a lot of after effects. He had it in July, and here we are in February, and he's still experiencing some of those problems. And one of them that he mentioned to me were the drugs that were prescribed to him. He said he was never on drugs before, so his body adapting to those drugs has been a real challenge. They seem to continue to have an effect, and it's affecting how he rests. And that's really important because, he's having to deal with these struggles. So it looks like Kevin Graham has said that has chimed in for the question of the day. He says funding for the American people, $2,000 each per month. So he is going along with the 54% that says we need more money, stimulus, more money. But again, what about the safety aspect? If we're getting the money and we're still not moving the ball forward as far as how we are getting our arms wrapped around this pandemic, the question, what should take priority in a federal COVID relief bill? 54% agree with Mr. Graham. It's more stimulus money. Well, it looks like $1,400 is on the way. That bill has moved its way through the Senate. Our Madam Vice President, Kamala Harris, she did cast the deciding vote. It was a 50-50 split down party lines, and she stepped in, and that stimulus package is on the way, so you can look out for that. As you heard from Dr. Washington, we expect Group 3, the frontline workers, teachers, law enforcement, to be a reality within the next few weeks. So we're looking forward to that happening as well. And here's some other good news. On February 3rd, and that's not good news because our numbers are going down, but I found it interesting. Today it's February 5th, but 2 days ago, the highest number of reported COVID deaths were reported in a day, and that was the first time since December 30th. So now we're headed in a different direction. The numbers are going down, the work is paying off, and we're encouraged that we will continue to wrap our arms around this. Hey, if you have any suggestions for guests or people on our show, reach out to rivenstanya@gmail.com. We're going to hop off a little bit sooner because our survivor, he was having some problems with his browser, not able to get on, but I can assure you we'll get him rescheduled. So make sure you have a great weekend. Join me on Sunday morning, Sounds of Inspiration from 7 a.m. to 9 a.m. That's a change, 7 a.m. to 9 a.m. So if you usually hop on about 9 o'clock, you're going to miss me. And that's WJIV Streets 1033, 100.5 FM. Have a great day. Thank you to our sponsors, including Genesis Project, Groundwater Solutions, Amelia Henderson Communications, and D-Rock Beach Skyland Restaurant, as well as House of Africa. As always, life's challenges make you better, not bitter. Have a great weekend, and thanks for watching Canceling COVID.